Hi, my name is Ibrahim. I'm a student physical therapist assistant from CBD College. Today I'm going to be explaining what the Trendelenburg gait is. And so the Trendelenburg gait is when you have weakness on one side of the hip, when the other side is on the weak side, so the other side is going to be weakened because of the weak side. So it's going to have a level drop. It's when the muscles that are there are the gluteus minimus and medius, and so when they are not leveled, that is what's going to start shifting the weaker side. So if I can give 3 exercises to progress that and help with the Trendelenburg, so we have side lying hip abduction, we have bridges with band abduction, and standing hip abduction with bands. So I'm going to explain those. I don't have a resistant band with me, but I can try to show a little bit. So with side lying hip abduction, you would lay kind of like this. I would have the patient lay sideways like this on their hip. And then you want to make sure that you're not laying on the weak side. You want to make sure that the weaker side is up here and you're strengthening it. So this would be the side lying position. And then the abduction would help it lift up. So the patient would lay on their side and they try to strengthen the gluteus medius. And so they would just have to lay like this, lift their, let me scoot up a little bit. They'll lay sideways, be lifting it up, trying to strengthen it. And then next, we would have bridges with band abduction. So, as I mentioned, I don't have the bands with me, but we do the bridges like this. You would lift up, and then you would do abduction, obviously, on the weaker side. So, as the bridges lift you up, you want to pull out. The band would be right here in between the knees. It would be strengthening it. And as you do the bridge to lift up, it would pull over to the side like this to strengthen the muscle. Then next, we would have the standing hip abduction with the band. You would stand like this. You would have a resistant band right here around your legs. You would be pulling like this, trying to strengthen it. So that would bring strength back into the hip abductors over here, strengthen the gluteus medius and minimus, and that would also help out with the Trendelenburg.